I'm Sanzida, and I'm really looking forward to this conference. Thank you.
Next, we have our discussant, Khadija Mitu, Dr. Khadija Mitu. She is the Associate Professor, Department of Anthropology from University of Chittagong. Khadija, very shortly, say hello to everyone.
Hi, hello. I'm really happy to be here as a discussant and looking forward to listen to the presenters for their exciting papers.
Nice. Nice, Khadija. Many thanks. We have 3 presenters as well. Our first presenter is just a brief introduction about them. So, our first presenter is so our first presenter is Rezwana Shahrin. So she is from University of Dhaka, and she has her presentation on paternity leave, fulsome or need of time. Rezwana, if you are there, kindly say hello to everyone very shortly. We cannot hear you. Still, we cannot hear you.
Can you hear me now?
Yes.
Okay. Hello, everyone. I'm Rezwana Shahrin. I'm from University of Dhaka, Women and Gender Studies. And today my presentation will be on paternity leave, fulsome or need of time. I'm really looking forward to presenting in front of you. Thank you.
Thank you, Rezwana. Thank you. And our second presenter is Tahia Rahman. She works with the Center for Men and Masculinity Studies, Dhaka, Bangladesh. So, Tahia, are you there?
Hello, everyone. Yes, I'm here. A good day to all of you, and I'm happy to be with you all. Thank you. Looking forward.
Thank you, Tahia. Our third presenter is Tonima Islam. She is from KIT Royal Tropical Institute from Amsterdam, Netherlands. Tonima, say hello to everyone.
Hello, everyone. I'm very excited and I'll be presenting today. So I'm very much looking forward to this conference.
Thank you, Tonima. Thank you for making it, keeping it short. So, so I will take 5 minutes of your time to present you about ShareNet International and this conference. So I'm going to share my my screen with you with the presentation. Let me see. Yeah, that one. Can you see my presentation? Just someone say yes. Okay, I can see that. Yeah, it is now. Okay. So ShareNet is a knowledge platform on sexual and reproductive health and rights. So it has ShareNet International started their work since 2014, and with the vision that all people have the freedom of choice, are able to make informed decisions, can take action on their sexual and reproductive health, and have access to quality care to meet their sexual and reproductive health needs and rights. With the same the vision and connecting with the mission is that to strengthen linkages between research, policy, and practice through sharing, generating, translating, and promoting the use of knowledge for the development of better policies and practices in SRHR. So you can see that with this mission, we are having this conference where we can share our knowledge with everyone around the world. So ShareNet International has 7 hubs starting from Netherlands, Bangladesh, Ethiopia, Burundi, Burkina Faso, Jordan, and Colombia. You can see that we are almost all over the world here. So recently we have a digital platform here. So our digital platform where you can find all our resources related to research and tools, and everything could be found in one platform from all the 7 hubs. I think Jessia is going to share the link to this platform so that you can access it and you can bookmark it for your future reference as well. Now this today's conference, we call it From Hubs to Bubs. So linking research, policy and practice. This is the international edition, and this is ShareNet International 10th Annual Linking Research, Policy and Practice edition. So the conference is all about, if I go to the next slide, its objective is to disseminate young people's knowledge on SRHR and gender equality and women empowerment, to create a safe space for open dialogue, linking and learning between different SRHR and GUI actors, to stimulate research-informed policy and practice, particularly in SNI country hub context, to identify further gaps in research, policy and practice, and lastly, to harvest networking opportunities. Key activities throughout the, for the last 2 months, we are having these activities. First, we had this abstract writing workshop. Those who were interested they joined that workshop. We had a capacity strengthening workshop with the selected young researchers. Then we have a knowledge sharing and discussion presentation session during the I mean this is the session actually. The number 3 is currently we are having right now. We have some networking parts. So today we have some networking session on our dossier. You will find those how to join those networking session today. And 5, the documenting of the knowledge in a creative way. So we are going to have a magazine after the conference. So by the mid-December, you are all going to have this conference, this magazine in your inbox. So far, this is all from ShareNet International and all about this this conference. So I will not take much time, but I will share share some guideline with you how to. I will call it the rule of engagement. So first is all about. I will. This first recommendation is for the presenters. So you will get, each presenter will get 12 minutes for their presentation, and after that, we will have, each presenter will receive 5 minutes time for question and answer. So how about the question and answer? So how to ask the question is that so you have to raise your hand over Zoom to ask a question, or you can write your question on the chat, so that our presenters can answer your question over chat. And I will also ask you to mute your microphone. So I was there like so for asking question, you can use the chat option, or you can raise your hand over Zoom. So we can guide you for your answer, questions. So these are all the rules. So now I am giving it to giving the floor to our moderator, Dr. Sanzida Akhter. So I will ask her to be very strict about the time. So we have to maintain a time very strictly. So that is all. Over to you, Dr. Sanzida. Appa, you are mute. You are on mute.
Sorry. Thank you, Kishada, for this wonderful starting of this conference. As like me, I hope everyone is excited and looking forward to listening to the presentation from these young researchers. I understand that the researchers are not like, like they are young researchers, so very interesting. The title of the conference, as you all know, Linking Research, Policy and Practice. I welcome you all to these presentation sessions, and I would like to first invite the first presenter, Rezwana Shahrin from University of Dhaka, and the her presentation title is Paternity Leave, Fulsome or Need of Time. Rezwana Shahrin.
Hello, ma'am.
Hello, Rezwana.
Rezwana, you can share your screen with the presentation.
Okay.
Yeah.
Can you see my screen?
Not yet.
Okay.
Yeah,
how
it's
about
coming.
now?
I think it's coming. Yes, yes. Now it's
Okay.
visible. Yeah, thank you.
Okay. Thank you
Just
so
one
much.
thing, Rezwana, I am keeping the time, and the moment you start, I will start my the button, stopwatch button. So I'll give you a warning at 10th minute, and then you will get 2 more minutes. Thank you.
Okay, thank you so much. So, okay, I guess you can see my screen now. Okay, should I start, ma'am?
Yes, you can start.
Okay. Hello, everyone. I'm Rezwana Shahrin, and you can see my topic here. So I'll jump right at the next slide, which is that what is my research is all about. It is about, so first I'll be sharing the statement of the problem. So why this paternity leave? Because it is a very unexplored area in Bangladesh, as I can say, because the situation in Bangladesh right now, that it has been seeing rapid urbanization for last 2 decades. So what happens with rapid urbanization is that there's a crying need of forming nuclear family and the breaking down of joint family. So what happens that when a nuclear family is formed, then you can see that there's this problem when a child is expected to come to the family. So what happens that there's only 2 persons who will be taking care of the children, the mother and the father. But what happens in this kind of situation in Bangladesh, this traditional role of women as a primary caregiver is so much celebrated that there is another half, the father, he is almost out of the picture. So I wanted to see that this problem we are going through in Bangladesh, all the debates regarding that we have to give maternity leave to the mothers, and the mothers are many of the cases of postpartum depressions are coming out. So what we can really do? So I thought that there is an unexplored area that a father needs to be there at the same time, but he is not being able because he is not yet out of his traditional role of the breadwinner. So what we can do is to give him some structural support like paternity leave so that he can contribute more to the family. With this vision in mind, I have set the research objectives to understand how some of the working couples of an urban context perceive paternity leave to have impact on their life by providing time to invest on family and trying to maintain a balance between family time and working time. And another objective is to analyze whether my respondents, the people who I have interviewed, think that paternity leave will make the process of motherhood easier for the working women and allow to bring some change in the existing gender division of labor or not. This is another reason that why I have purposefully chosen the word fulsome, because in this context of Bangladesh, I was not yet sure that whether how the respondents will say that how they perceive paternity leave. And then I have formulated the research question that I really wanted to know, that can introducing paternity leave play a significant positive role in both family sphere and workplace by giving opportunity to the father to contribute more in the family and hence revise the gender division of labor. So I have 2 main points, that how can a father play more role in a family, and how can the gender division of labor, which is hindering our women from participating in the workforce and which is hindering us from achieving the greater gender equality within household and within the private sector as well. So I wanted to know this about this. So my literature review and analytical framework, I have gone through the literature review, and I have seen some interesting factors like choose it or lose it, which is a Norwegian connotation about the daddy quota. So now if I want to say that what the daddy quota was, Norway is very generous with the parental leave. They first introduced parental leave actually in 1956 with a 12 weeks of leave for the parent, but basically it was for mother. But they understood that the father needs to be in the picture too. So what they did was that they sanctioned the paternity leave to their father also, and by 1977 the fathers were given 4 weeks of paternity leave, which they had to choose it within the year of their child's born, or otherwise it will be like denied. So this is called the choose it or lose it law, and it is also known as the daddy quota. So what happened after this formulation was that the work conflict of Norwegian family was supposedly to be reduced by 11%, and it is a huge thing, because when you are giving a structural support, a small support like paternity leave, then it really helps in reducing the work family conflict to the private sector. So it is a very phenomenal thing, and there is this dual earner policy model of again for Norway, that it says that women should come forward in the workforce, and it was also very fruitful after the execution of the paternity leave, which became very generous not only in Norway but other Scandinavian countries. Like in Sweden, we can see that the 480 days of parental leave, which also gives a huge share of paternity leave to the father, which saw that the gender, those countries are doing higher in the gender equality rank. So it's they actually work. And for my analytical framework, I have divided the subject in two, like conceptual framework and theoretical framework. My conceptual framework actually says about parental role and fatherhood. Bowlby's one of the Bowlby's theory of attachment shows that the children needs to be in the presence of primary caregiver within the 2 years of after their birth. Otherwise, those children fall victim to depression, and they have lower IQs. So what happens in this urban scenario when a mother goes to work after 6 months of her maternity leave? Then the child needs another primary caregiver. So who can be there? Of course, the father. But if he is not given any structural support, how will he be present in the household? So parental role and fatherhood, and another thing is masculinity and paternity. According to Connell, masculinity is a cultural problem, and we can see that by drawing a difference between the Scandinavian countries and Bangladesh, where in a traditional country like Bangladesh, where like breadwinner role is so prominent and mother-child picture is so big that the father is not even in the corner. So what happens that they are not going forward with the gender equality and all, because they are not addressing the traditional things that are hindering us from going to the road of gender equality. But if we see the examples of Scandinavian countries or other countries where paternity leave is generous, then we can see that they are doing great in terms of gender equality index and all. For my theoretical framework, I have opted for social role theory, which shows Alice H. Igley's social role theory, that if we if we keep conforming the existing gender roles to the sexes, that even if they are in a situation where the gender roles should not be performed, but they perform it because they have learned it that way. And I have tried to relate those my literature review and analytical concept with my findings, which I'll be discussing later. So my research methodology is I have opted for qualitative method because it will help me in going forward and like taking the information more. I have gone for purposive sampling.
Rezwana, I'm interrupting you. I think you should focus on your findings rather than methodology because your time is running out.
Okay, okay, sure. Then I'll skip this slide. And my findings actually shows, an analysis shows that the respondents, I had interviewed urban middle class respondents, 8 couples. 4 couples who where the father used to get the paternity leave, and 4 couples where the father will do not get paternity leave. So both, according to their interview, they have said that paternity leave is a right of fathers as maternity leave is a right of mothers. It was my key finding, because I was very skeptical that how the traditional men of Bangladesh will perceive paternity leave, which is a very new concept. But they came and they say that they considered it as a right. And then they say that economic growth will not be hampered because of paternity leave. And then we can see labor market will see positive impact, because if the father is satisfied with his time he has spent in household, then he can go to his work with a fresh mind, and the mental and physical health can be ensured. Again, I can draw it to the Bowlby's theory of attachment and say this. And then equality in society can come nearer to reach. I have explained it earlier. And family bond will increase. Of course, when the father is more in the family, the increase will bond will increase. Policy recommendations, I want to make it clear that the policy recommendations I'm giving here are the recommendations based on my respondents' reaction to the questions. And I had interviewed 2 gender specialists as well, so it is not solely based on some amateur desire, but also has some strong academic back as well. So my first recommendation is that a paternity leave for 15 days, which was sanctioned in 2014 from the Prime Minister's office, but with no further advancement on the topic, and is not on the paper at now. It was granted for 15 days, where my respondents had said that they do not
past 10 minutes, Rezwana. 10 minutes is over. Yeah.
Okay, ma'am, sure. I'll be finishing very shortly. That they think that 15 days of paternity leave is not enough for them. If 6 months is granted to the mother, the father should be given at least 1 month, and they should be able to choose it by themselves. Like within 1 year, they can take it as installments. And they say that full-fledged salary must be given, or at least 80%, like the Swedish law. Otherwise, they will not be encouraged to take it. And then not only in government offices, but also non-government offices and other and even business persons should be taking this leave. Otherwise, the implementation will not be equal throughout the country, and the celebration should be very focused. Like we should focus on the promotion through our media, and examples can be taken from other countries, but we really have to take in mind the social cultural scenario of Bangladesh as well. So that was all from me. Now the floor is open for you to comment on that. Thank you.
Thank you, Rezwana. This is wonderful presentations with a new insight. I think it is rare that study is going on study on paternity leave. I think is not very frequently happen. So congratulations for choosing such a exceptional topic. Kishorda, should I take question now or after completing all the presentations? What do you suggest?
I think that we can take questions for 5 minutes.
Okay. Oh, thank you. So if anyone has any questions, please ask or write in the chat box. Question or comments or anything, or any feedback for Rezwana to improve her research.
I see a hand from Tahia.
Oh,
Tahia,
please.
Yeah, unmute yourself.
So thank you, Rezwana. It was wonderful presentation, and the topic is very much raising concern for all of us. But I won't criticize, but I just want to compliment one policy recommendation. We have to work from both sides. We need structural changes. We need to introduce paternity leave. At the same time, we also need to sensitize the fathers. We need to ensure if they are still ready to accept that, because
pin karen, okay.
Oh, okay. Because from one of our study, we have come to know that whenever father is in leave, he will just few fathers, I must quote, they will demand more snacks, more teas, and that will just that will just increase the burden of women. And we also seen in the COVID situation when we are all working from home, and both the male and female are working from home. So there are reports that they are still not sensitized to share the household burdens and so on. So I think we also work together to on that perspective, so sensitize the fathers. And just one more comment: if we use masculinities rather than masculinity, then we will be able to capture all the men and all their different perspectives. Thank you again.
Okay, thank you so much for the insightful comment. Actually, when I decided the topic, I purposefully chose the word like fulsome. In Bangla, it translates as adikheta, because I was really skeptical that the traditional fathers, whether they will be accepting this new thing or not. And my supervisor had said the same thing, that what if I grant the leave to the father and he comes and says that, make tea for me, make snacks for me. So this will be like another burden for the women. But when I actually went to the field and interviewed the father, of course, the numbers were very limited, because my resources were not letting me interview on a vast scale. So I was interviewed very few people, but they had come and said some things, but I acknowledge that the floor must be open and we should do a very vast research on the topic before implementing this. So the floor is always open for research. Thank you so much, Tahia.
Thank you for the answer. I just wanted to focus that we need to work from both ways. That's my point.
Sure.
Yeah,
sure.
you.
Thank you both, Rezwana and Tahia. Very delighted to see this conversation, and I think the issue of paternity leave is a very timely demand, and we have to work for that. Anyway, I think we should move to the second presentation, which is Tahia Rahman. She is presenting on accessing SRHR services during COVID-19 scenario of Bangladesh. She is from Center for Men and Masculinity Studies, Dhaka, Bangladesh. Tahia Rahman.
Thank you. I need permission for sharing my own screen.
You have been made co-host already, I think.
Okay, yes. I'm sorry. Yes, here it is. I think you can see my screen now.
Yeah.
If
Yes,
it's visible, okay.
Yes.
So, thank you
Tahia,
again. Yes.
Tahia, sorry, as I said to Rezwana, I will, the moment you start speaking, I will start my timer and give you a warning at 10th minute.
Yes, I'm proceeding accordingly. Thank you for the reminder. So my title is Accessing SRHR Services During COVID-19 and the Scenario of Bangladesh. And I must say that the research was conducted based from a campaign which was named Brave Man Campaign. We all know that with many other aspects, COVID-19 also have different gender aspects. We already know about the gender-based violence, which highly increased during the COVID. So looking towards the SRHR services was another vision to see the scenario of Bangladesh. So the core objective of my study was to initiate an online policy dialogue on the gendered impact of the COVID-19 pandemic concerning violation of the rights in accessing SRHR services during COVID-19, and to maintain the social distancing and to promote online activities. We conducted the study online. So if I just tell a bit about the methodology, we used our social platform, and the data was collected online via survey, and we also collected interview via Zoom and over telephone calls. And for this survey, we reached up to 450 people from both male and female, and there were very few people who were from the gender diverse community, and their age were from 15 to 60. And through purposive snowball sampling, we have collected interviews from 10 people. And as I just said, that was conducted via Zoom and Skype. And the analysis was also disseminated through social media. We posted through different memes, and we also conducted webinars. Okay, so I just jumped to the findings. So as the study time period was 6 months, and as I just said, we have covered 450 people from all over the country. Maybe this is not the scenario of whole Bangladesh, but I think it will help give some ideas about the problems, raising problems regarding SRHR services. So the first finding I want to focus is that fewer people taking SRHR services, even worse, most are not taking any services. Because though all of us are working hard to promote SRHR, the fact is that it's not that important among the general people in our country. As all of us were tense with the COVID-19 situation and other health aspects, so the SRHR services like contraception, paternity, maternal health, menstrual hygiene, these just got less priority according to our survey. The next finding I want to focus is that mostly young adults in early 30s are always facing trouble getting the service. As we know that we always consider SRHR as the concern of married people. And so that was also one of our findings, that the young people say they definitely had problems they wanted to discuss, but they were not encouraged or they were not welcome to seek their concern in health services. Okay, the third one is that the lack of transport and lockdown during pandemic worsened the situation, definitely. So we had in strict lockdown from March to June, and then the people had the most difficulties during the SRHR, regarding the SRHR service seeking behavior. Okay. So these were three general findings. Still is that inadequate service and essentials. Okay, so my internet connection seems to be stable. Can you hear me?
You are cutting off slightly.
Can you hear me?
Yes, we can hear you right now, but continue.
But am I in the screen now? Okay. So the next was inadequate services and essentials during this pandemic. Going to ever such a situation may result in difficulties of access to contraception and sanitary products because women hesitated to go to the shops because there were strict lockdown and they had problems managing their sanitary products. And there were also in the maybe there were sufficient products in the larger shops, but in the local areas, there were shortage of sanitary products, as the respondents said. And there were also shortage of doctors, nurses, and other healthcare professionals. And definitely the pregnant women who need to consult the doctor physically, but they could not decide whether they need to step out or they need to wait for the situation to be a bit better. So they were just puzzled during the situation. Okay, the next finding was that some people are giving up contraceptive. Maybe it seemed to be a very radical change, but yes, we found there were some people that they assured us that yes, for the timing they didn't use any contraceptive. And another shocking, I must say, another shocking finding was that young people are taking long-term methods, which we know, and also in our webinars, the experts also agreed that the young people should use the safer methods, the short-term methods, but as there were lockdown outside, so they just thought of taking the long-term approaches. Maybe, I'm not sure, but we can assume that they may have the side effects. Okay, so the last finding was that people are used to get consultancy from doctors physically rather than online services. As I just said, we are not much familiar on the online platform, and online seeking doctor online is definitely a new practice for our country people. So in different cases, they tried and they waited for a better situation, and they avoided meeting the doctor physically, and that made the situation more critical. And as I just said, the pregnant women face the most difficult situation. Okay, so from these findings, we want to recommend few things from our side, that online services should be more effective and more familiar to their country people, because as they're very locked down and people just cannot go outside. And yes, during COVID situation, we should not go outside. We need to ensure the social distancing. So if like the developed country, we can promote online counseling and online concentration from the doctor, that can be an effective way. And people at the same time need to be more reliable on the online platforms. And this is just a practical level suggestion, I must say. And if I think from a broader perspective, if I want to have vision in a strategic way, I must say that moral and gender education complemented with sex education is still a concern for all of us, because people are not taking SRHR seriously. They have started to take seriously, but yes, there are still scope to improve more. And prioritizing mental health issues. Mental health issue is still a rising concern. People have started to be sensitized, and at this, as sex education, we still have scopes to improve the awareness regarding mental health issues. And we may introduce new technologies, like as young people are more attached to electronic devices, like different mobile applications, Facebook, Instagram, etc. So we can use those platforms to introduce sex education that can attract them. Okay, and there must be some policy level interventions, and engaging community gatekeeper is definitely a must. And okay, so from our study, we had two learnings. First is that people yet hesitate to talk about their SRHR issues, but what we did, if we can create a friendly environment, if we take a more time in rapport building, they just open up. And this is a very important learning in our study, that we invested more time in rapport building, then they opened up to talk on SRHR issues. And the second learning is that we to make our study inclusive, we wanted to welcome the people from gender diverse community. But the thing we learned is that there must be particular study for them. There are different issues that cannot be what should I say, that just can't capture their dimensions of life. So if we really want to include them, there must be a particular focus for them and particular study. That's all very shortly from my study, and you can see just how we proceeded. Thank you. Thank you. I'm just stopping here and waiting for the questions.
Thank you so much, Tahia. It's a wonderful presentation. Especially, I was carefully listening to the recommendations part, and the last recommendations, that really the gender, particularly, studying anything from gender perspective, not necessarily can incorporate all the concern relating to LGBTQ community. So it is a wonderful idea, and to emphasize again and again to particular research focusing on those community. Thank you. Any questions for Tahia or any comments?
Sanzida, I see that someone has asked question on the chat. So Tahia, you can go like Muhammad Islam asked that what kind of contraceptives or method used before the jump to LRCPM. So
Acha.
if you need Muhammad Islam, if you can just elaborate the LARCPM, that could be, I think, useful for Tahia as well. Tahia, do you have any answer for that?
Still searching in the chat box. Was it
Or
from
maybe
Shakil Mahmoud? No.
No, before
No,
that,
no.
yeah.
Before that, okay.
তার আগে, হ্যাঁ, মোহাম্মদ ইসলাম। শেয়ারনেটের মেসেজ, দুইটা শেয়ারনেটের মেসেজের মাঝখানে, in between.
Yes. What kind of contraceptive method used before the jump to the long run? Right. Okay. So generally they used condom, and the women used to take pills. And long term, we found IUDs and injections.
Okay. And I think you have another question. No, Shakil Mahmoud Chaudhry is has made a comment that I think one of the important reason is missing for accessing SRHR service due to lose job and financial crisis as a consequences of losing work and job. Definitely, this is one of the main reasons during COVID-19, which hampered many things. Any other questions or comments for Tahia on
There is another question from Ramadan Kirundas. So asked, thank you so much, Tahia, for the presentation. Our community or village-based SRHR service points in Bangladesh. We have village health teams in Uganda that help in rendering some services, for example, contraceptives. Thank you.
Do you have Tahia?
Yes, we also have wide range of services in all the community level. But as I just said, it was very particular study on the COVID-19 situation. So the situation got very different. And we just found that people we are not able to get enough services from those service centers due to COVID lockdown and all.
I think another question. Muhammad Islam, from Muhammad Islam, the last one, Tahia. Is there any urban SDP? Yeah.
Is there anything? The study covered both urban and rural areas. So the finding represent both.
Yeah. Thank you, Tahia. And I really proudly take this opportunity to say that both Tahia and Rezwana is from the Department of Women and Gender Studies. Tahia is my direct student and one of the alumna.
I'm so honored. So much honored.
Rezwana has just completed her master's last exam and viva yesterday. And I'm so proud of both of them, and special thanks to you from myself. And I would now like to welcome the last presenter, Tonima Islam Trisa. She's from KIT Royal Tropical Institute, Amsterdam, the Netherlands, and her topic is really interesting. When I was looking at this, the first part of the title, Searching for Light and the End of the Tunnel, an analysis, very thoughtful articulation, and analysis of Bangladeshi women's help-seeking process following intimate partner violence. Tonima Trisa.
Thanks a lot, Sanzida madam, for giving me the floor. So now I'm going to share my screen, if you allow me.
Yes, I think Kishorda made you co-host. Yeah.
Okay, so I'm going to start my presentation now. Hello, everyone. I am Tonima Islam Trisa. I work as a public health researcher in Bangladesh, and I just finished my master's from KIT Royal Tropical Institute, the Netherlands. And this research that I'm going to present is actually from my master's thesis. And the title of my research is Searching for Light at the End of the Tunnel, an analysis of Bangladeshi women's help-seeking process following intimate partner violence. So I'm going to start my presentation with a story. This is a story of Salma. Salma is a 30-year-old Bangladeshi woman who lives in a rural area. Salma is married and she is experiencing violence from her husband for past 2 years. So in the beginning, Salma spent a substantial amount of time contemplating about the problem, and her thought process was greatly influenced by the community that she lived in, because in her community, violence towards wife from husband was a very common thing among couples. So after a while, Salma decided to share this problem with some of her close friends. While some showed understanding and support, most of the people in the community actually blamed her and thought that this kind of personal issue does not need external attention. When things got worse, Salma tried to seek help from the formal services, but then again, along the way, she met a plethora of challenges which further disrupted her chance of getting any help. So Salma is actually not alone. She's a representative of thousands of women in Bangladesh. Violence against women, especially intimate partner violence, is a huge public health concern in Bangladesh. According to Violence Against Women survey, 73% of Bangladeshi women experience IPV or intimate partner violence. Among them, 70% never disclose this to anybody, and even less than 3% seek any kind of formal help. So intimate partner violence is a violation of human and sexual and reproductive rights. And when a woman is long-term exposed to this kind of violence, this can result in injury, death, pregnancy loss, STIs or sexually transmitted illness, poor mental health, poor child health, economic loss. And at the same time, the low reporting can cause underrepresentation of the problem, which makes it even harder to address IPV. So the objective of my research was actually to build a comprehensive understanding of the health-seeking pathway of a woman who is exposed to this kind of violence. And at the same time, I tried to identify factors that can influence this pathway. And through my research, I actually tried to address the knowledge gap that exists within the literature body about this topic, and also make recommendations for policy and practice. So for this research, I conducted a literature review of published and unpublished literature, and I used this conceptual framework to guide my analysis. So I actually borrowed this framework from Canadian colleagues, and I made some adaptations to this framework. So this framework actually showed a great potential to answer my research question, because this really recognizes different stages that a woman go through after being exposed to violence towards getting help. And at the same time, this framework also takes into consideration factors from outer layer, from broader context that may have influence in the pathway. So I'm now going to present some highlighted findings, and some factors actually are more understood than the others. And I try to portray that by using these green buttons. So when the buttons are full, it means that these findings are based on strong evidence. And when the buttons are not full, it means that there is a research gap and these areas need more research. So when it comes to the first stage, which is the problem recognition stage, so according to the literature from Bangladesh, individual violence condoning attitude, which is the acceptance of violence from husband, which is very prominent in our culture, and at the same time, fear of stigma that comes with disclosing this kind of personal matter out in public. These were the major two factors which clouded women's judgment and actually failed her to recognize this problem in the first place. When it comes to access and service level factors, now these areas lack research, but according to the existing evidence, cost, distance to the facilities, lack of quality and proper information, having doubts about the usefulness of the available services, attitudes of the providers, and lack of satisfaction after attending the services. These were the major factors that discouraged women from seeking out help from formal services when they were exposed to violence. When it comes to the factors from broader context, education, marital age, employment were three very major factors that determined formal help seeking. So it means that women who are educated, who are married at the age of 18 or above, who are employed, they are more likely to seek out formal help when they are exposed to intimate partner violence and have overall less violence accepting attitude. Severity and frequency of violence was another major factor that determined or predicted formal health seeking. Now, this also kind of communicates that providers in our country, they are not trained to deal with IPV beyond just treating injuries. In Bangladesh, at the same time, informal support sources, that means family and friends, played a major role to influence women's decision to seek out formal help. And unfortunately, in Bangladesh, family and friends and also the community norm, they discouraged women to seek out formal help even when they needed it. Now, some factors were limitedly understood, which means that they might not be the independent factors which determine formal help seeking and may be related to other factors. For example, not just presence of children, but if those children are also exposed to violence, that determined formal health seeking more than just presence of children, and not just socioeconomic status. If that is a result of women's employment, now that determined formal health seeking more than just women's socioeconomic status. Now we come to the final and last part, which is actually very relevant to the conference, which is how this research can be translated into policy and practice. So now when it comes to practice or intervention, according to the findings, women really lack quality and proper information about the available services and their rights. And the government should really focus and invest in generating and circulating quality information through digital media, through its multi-sectoral program. And I think this has been become more evident in the time of COVID. And at the same time, since we are now experiencing a digital revolution in Bangladesh, so I think this actually holds a great potential to address this issue, as more than 90% of women now have access to mobile phones and internet. So government should really utilize the digital medias to spread out information. Also, according to evidence, community-based intervention that actually challenge the gender norms or community norms have been more effective to address this problem from the root. And the NGOs and the government organizations should really invest in this kind of intervention. The providers, and this is applicable for both medical, legal, and social support service providers, they need to be trained to deal with a sensitive issue like IPV. Now, when it comes to policy, I think we have major loopholes in the legal system that treat IPV as a personal issue. And for example, they don't, it actually don't recognize marital rape, for example, as an offense. So these loopholes needs to be addressed first and foremost. And this will also give the providers a good ground to actually respond to IPV more appropriately. Now, the study again proved the powerful role of female education and employment. So government should really formulate policies to improve female student retention, especially in the upper secondary level school, because that's where the female students drop out a lot more than their male counterparts. And government should really also formulate policies to expand government employments for female. Now, the study also pointed out that only focusing on women is not going to be enough, and males need to be engaged in all kinds of information, all kinds of intervention as allies to effectively address IPV. And this needs to be written down in the national strategy to address violence against women in Bangladesh. Thank you very much.
Thank you so much, Tonima. Wonderful presentations and very important topic on this. And I was looking at the recommendations, very solid recommendations you have brought up.
Thank you very much.
Any comments or any questions, suggestion for Tonima? Tonima, can you look at the chat box? Someone asked a question in the chat box, and I also see a hand raised from Camila LA. So Camila, can you ask your question first? And then Tonima can look at the chat box and.
Thank you, Tonima, for this very important topic. And I think it really needs to be discussed and addressed everywhere. I was wondering, because I read that you also included religion and ethnicity, if I remember that, as a factor influencing the seeking for help. And I was wondering, how did that work? What can you mention about that? Because maybe you can also include that in your recommendations, isn't it? Seeking participation from religious leaders as well, or someone from the community. So that's why I was asking this particular question. Thank you.
Thank you very much, Camila, for the question. I think it's a very important question. So I actually categorize the religion as the factors that are limitedly understood, mostly because it is because of lack of research. In Bangladesh, actually, there have been quite a bit of studies, but not particularly focusing on the help seeking of IPV victim. So I also included studies from neighboring countries like India, which actually have a very similar context. And I tried to compare results from both India and Bangladesh. So in my review, I actually noticed that religion, there is no particular study that actually answered this, that if religion has a role to play in terms of help seeking behavior of women, if Muslim women sought more help, if or the women from Hindu community sought less help. So this was not answered, but indirectly I got links for example, Muslim women have overall in Bangladesh less freedom of movement from their family. So this indirectly also indicate that they might have overall less help seeking, because they have more less freedom of movement, so they might not seek help even when they need it, even in terms of not just violence, even in the other health problems, they may not seek as much more as maybe other people from other community. But this was not actually, I did not find a concrete answer in the existing evidence. And obviously I also put a recommendation that these areas need more research to actually find an answer to that.
Thank you so much.
You're welcome.
Thank you, Tonima. I think any question in the chat box for you? I think it's only comment, Tonima, you can read those, and if you would like to add anything on that. I think one more hand raised, Corey D. Conning.
Mute. Very great presentation. Thank you very much. I have two questions, but just see if there is enough time to answer them. The first one is, what criteria did you use to judge the evidence for your green dots in that you presented? And the second one is, what entry points do you see to actually start implementing your recommendations, or which ones would be the low-hanging fruit, to say so? Thank you very much. I really enjoyed your presentation.
Thanks a lot, Corey, for your question. I think both of them are very important questions. So to answer your first question, so about categorizing about the quality of evidence. So the evidence that were based on large scale population-based studies in Bangladesh, I categorize those findings as being strong evidence. And if the findings are based on small scale studies or just qualitative studies, or if different studies generated variable results, only then I categorize them as limitedly understood, or as or recommended that these areas need more research. And to answer your second question, which is, I think, what should be the entry points in the existing programs and policies for my recommendation. I think the entry points would be first of all, I think the way to go would be to think of integrating services into the already existing system, and also work on the current existing programs which are already in place, rather than investing in new programs. That's why I recommended really invest in generating and circulating information through the currently existing multi-sectoral program against for addressing violence against women. That is already a current running program by the government. And at the same time, I also recommended training of the providers. So we already have providers in the legal, medical, and social support system. So really training them to respond to a sensitive issue like IPV, and the victims more appropriately will probably attract more people to actually seeking out help or information from the providers. And at the same time, I think another recommendation was also formulating policies to also engaging males in the current intervention, and not just only focusing on women. So these are, I think these should be actually the entry point to work on the existing programs and services rather than starting a new initiative.
Thank you, Tonima, for wonderful discussion, question, answer, and presentation. With this, we have completed all these three presentations, and now I would like to request our discussant, Associate Professor Khadija Nitu from Chittagong University Anthropology Department. Khadija Nitu, please.
Thank you, Sanzida for inviting me to discuss. And what can I say as a discussant to the wonderful presenters? I'm really amazed to hear all the presentations from such young researchers. I doubt I would have done good research at that age. They're fascinating. All the presenters, regardless, they chose really good topic, followed methods and theories, and presented their findings and policy recommendations very well. I congratulate you all for presenting. I have some, Sanzida didn't tell me how much time I can take. I don't want to go very in detail for each presentation, but what I see a pattern in all those presentations is that I see an absence of...
Just to interfere, Mitu Appa, I think we have to complete by 10:15, and now it's 5 past 3. Okay. So yeah.
Okay. Okay, I'll be very quick. So what I see a pattern in each like all of the presentations, it's that I don't see the intersectionality per se. I don't see the class differences or the locale differences. For example, I think in Bangladesh, the rural areas and urban areas are quite different in terms of facilities, organizations, and the kind of community services and other services are given. And the class differences are also very, very prominent. Like urban middle class and upper class women and men are very different than a rural lower middle class and poor class women and men. So when we are talking about issues like paternity leave, SRHR service-seeking behavior during the COVID pandemic, and also service-seeking behavior for IPV, we should really acknowledge the differences between rural and urban and all the different classes, like economic classes. I totally agree that all these research were small-scale research, and these researchers are really young, and they are going to conduct more research in the future, I would urge you to take into consideration when you are discussing your research or your presentation, that which section of the society you are working with. Like when you were talking about your respondents, you should really mention that who are the respondents, like from which urban or rural area, which area or which class, and what are the differentiation that you see in your respondent groups, if you have multiple groups. For example, when, like in the first presentation, when Rezwana was talking about traditional fathers, what do you mean? What did you mean by traditional fathers? Was not very clear to me, but I totally understand that you are talking about some social norms or gender norms aspect. So if you could pinpoint more that which fathers are talking about paternity leave and how, I can see that the kind of family structure is growing up in Bangladesh in the urban, upper class and middle class working couple families are quite different than, you know, in the rural, more, we don't have like extended family that much in Bangladesh now, but then when you have extended families living around, and when you have more family members to give support, you know, in contrast to people who are living in urban, you know, cities, working both the husband and wife, paternity leave is more, how can I say, crying need for them, or for the education status and the class might affect their need and practices for paternity, for childcare. So that's what I was trying to, you know, sort of urge you to think of the nuances when you are doing a research, and when you are selecting your respondents and analyzing the responses that you get from your respondents, to sort of contextualize them in their, you know, class and gender and education and, you know, locality, etc. I'm just going, you know, to comment like more generally rather than presentation by presentation, but still some of the issues that I thought that we should, you know, just to pinpoint is that when we're talking about SRHR services for, you know, during the COVID-19 presentation, COVID-19 pandemic, we found that adolescents and youth were really totally deprived for any services in Bangladesh regarding the SRHR. In Bangladesh, unmarried adolescents and youth are totally deprived from the practices and the policies to get many different kinds of SRHR services. And then they do that under, how can I say, like behind the curtain. They sometimes, as unmarried girls and boys, they don't get access to contraception and or some other maternal health or abortion services. Those are like really difficult for them in Bangladesh. But when the pandemic happened, they were even restricted because they were not going out. The transportations and all the service centers were closed. It was a really great crisis for them. So we should really think about, you know, how to deal with that. And then, you know, just connecting to this, we see in recent years, when we see any recommendation from any research, any implementation or interventions that we are thinking of, we're always talking about digital media, or we're always talking about using the internet and, you know, phone and other digital medias to you know, sort of communicating or, you know, information, how can I say, information dissemination services. But then again, we have to think about all those differences of the beneficiaries that we are thinking of. So who has access? While we know that in Bangladesh, we have more and more people who get access to digital media or internet or other forms of electronic devices, but then we have to be very careful that who we are targeting to, and if all the people or all the adolescents, all the young people, all young people from different classes are getting that services or not. I'm just trying to, ask you or urge you to focus on those differences, or think through when you are planning your research, or you are furthering your work. I congratulate you all. I enjoyed very much that how good work you had done. It's really amazing. I wish you all the best for the future research. Thank you.
Thank you so much, everyone, for joining and participating. I can see a raised hand from Shakil Mahmood Chaudhry. If you would like to say anything in a minute, please.
I want to say hello.
Ji,
Are
hello.
you hear from me?
Yes, yes,
Do you
we
hear
can
from
hear
me?
you.
Okay,
We can
okay.
hear you.
I just want to tell that from Tonima's research, there is some recommendations, but I want to add an important that I already mentioned in chat, that marriage counseling should be introduced and should be mandatory for the marriageable boys and girls. And in marriage counseling, if we include this IPV and the intimate partner violence and gender-based violence, and if we can aware our adolescent boys and girls about these issues during their marriage, it will be more helpful. And the second, I want to mention from Tahia's research. I saw some the SRHR receives that she mentioned that some receives great service. So what she mean by the great service? I couldn't understand. It should be, I think it should be clear what are the criteria that she mentioned is a great service, or I just know that is we are familiar with some quality service, but there should also some criteria regarding quality SRHR service. So what she mean by great service, I didn't I am not clear about this. And the third one, again, Tanima's research, she mentioned this, the IPB regarding the women's case study, but what are the reasons and why male committing this, husband committing IPPs for IPPs to the wives, and what are the cause influencing male for committing IPV to the wife? It is not clear. I think this research is just a bit of one-sided, that women's perspective are not mentioned here. How, why and how.
Thank you. Thank you, Mr. Shakil Mahmood Chaudhry, for your valuable input. Just to add one point in your last point, which is about Tonima's research, that she did not bring male perspective or male's experience on this. I think they all acknowledged, all the three presenters, that their research is a sort of small scale, and it particularly focused on particular research question, which may not cover all the men's experience and identity issues. So I think these three research actually opens avenue for doing further research in broad scale, which Rezwana Shahrin, with a great emphasis, said that a large scale research on paternity leave. And I think all these three research actually opens the scope for doing more research, including intersectional perspective, including male perspective, and all of the things. And we actually would like to wish all the best to these new young researchers, so that they can explore these issues more doing further research or further knowledge sharing or further publications. And thank you, ShareNet, for sharing this platform with them and with us for enlightening us with these very time-bound issues, contemporary issues, burning issues. And with this note, I would like to thank everyone. Kishorda, up to you, if anything.
Sanzida, many thanks. We are already short in time. We are over 3 minutes ahead. I know this platform will be used by other hub as well. So I'll be very short. I'm really thankful for with the presentation and who have joined here today. We have some links here with the link with the feedback form. I would ask you to give your feedback regarding the session, and we have our magazine will be come out by December about the conference, what has happened all day today. We have networking sessions here. Link is there in the chat, so I will ask you to go through the links. And one last thing is that ShareNet Bangladesh annually organize a SRHR knowledge fair. So this will happen Sunday next from 9:30. We have you can watch it live on our digital platform. The link is there at the end, so you are all invited. So with those notes, I would like to conclude here. Thank you once again.
Thank you.
Thank
so
you
much.
all. Yeah, thank you very much.
Bye. Bye.